I'm John Giever for MedPage Today in Paris for the International Conference on Alzheimer's Disease. The conference gets underway on Saturday, but I spoke beforehand with Dr. William Thies, the medical director of the Alzheimer's Association, which sponsors the conference. We talked about what the attendees and clinicians around the world can expect from this year's meeting.
Well, I think what we're going to see in this meeting is a continuation of two major trends. One is increasing interest in biomarkers and increased understanding of biomarkers, that they're not all created equal. There may be different biomarkers that are going to be useful at different parts of the disease, different sections of the disease. I think we'll also hear much more about early treatment with the publication of the Alzheimer's Association National Institutes of Aging criteria for Alzheimer's disease that now covers the continuum of Alzheimer's disease from the very earliest stages when people may have pathology but actually no symptoms at all, through an early mild cognitive impairment stage to finally a stage where people become demented. These are now three distinctly different categories, and we're going to see much more interest in testing new medications in the earlier stages of the disease rather than waiting until people become demented.
But although this work is making rapid progress, it's unlikely that these predictive tools will be clinically important anytime soon.
Without a therapy that's useful in the preclinical and mild cognitive impairment stages, the enthusiasm for diagnosing those stages in clinical settings will be fairly limited. Now there's going to be some further limits because as we sit here today, there really is no commercially available testing of either CSF biomarkers or amyloid imaging. Now the amyloid imaging is going to become commercially available fairly soon because at least one product has been put into sort of an approvable state by the FDA, but the FDA has said that you need to make sure that an average radiologist can read your scans, and so you have to have a training program. So that training program is being developed as we speak. I expect that to be finished very shortly. Once that's in place, then we will have a commercially available test for looking at amyloid in patients' heads while they're still alive. And I think that will be taken up by some early adopters. There will be some patients that will want to have that information. It'll be a relatively small number of patients because they're going to have to be curious about the outcome of the test, and they're also going to have some significant financial resources because it's unlikely these tests will be reimbursed for some time.
He noted that this research has implications beyond the lab and the clinic.
We really have to have a better way of identifying people with the disease very early on, and we have to have better treatments because the economics of seeing the full-blown Alzheimer's epidemic, in which we're in the earliest stages, are simply untenable. We won't be able to pay for the medical care for all of the people with Alzheimer's disease if we allow it to reach the numbers that we anticipate by the middle of this century. So this is not only a medical problem, it is a social problem of huge magnitude.
In Paris, I'm John Giever, MedPage Today.